right, so this is Mike, and we did a stem cell procedure on his left knee last July. So we are approaching 9 months since your procedure. Why don't you tell me a little bit about kind of what brought you in, what kind of symptoms you were having? Just start with that.
Okay, I had what they thought it might have been a deep vein thrombosis. I had like inflammation on my knee, and they ruled that out. And I had to go through 2 or 3 surgeons. One of them wanted to re-break my legs, and so these were all team doctors. I'm not going to get into that, but I ended up finding, luckily, Dr. Derrington and their regenerative medicine, and so they found out there's a bone bruise in my femur, and it was going to sort of indefinitely. Nobody really had a solution, and I was getting achy throughout the day. Early on would be okay, but then towards the end of the day it was unbearable, and I'd have to take some sort of pain medicine or tequila or something. But so finally we got to the point where we're going to do this procedure in July of last year, and within a couple days I was moving around on crutches, and then in a couple weeks I was walking, and so now I'm about 95% better. I can do, I've been running. I was barely even able to walk before this procedure. I mostly swim, and the weather has been kind of bad, so I haven't really had a chance to get out and really test it. But I just had a booster today, and I'm very optimistic that it's going to get to 100%. I'm very surprised at age 57 that I could even heal at all, and just thank God for Dr. Derrington and his staff. That's all I can
That's
really
great.
say.
And what's your activity like now, and kind of what was your rehab like, and some of the therapy things you're doing?
All right, so I went to Dr. Dave Pachkowski, and luckily I found him. So rehab is vital for this, getting more and more mobility. I was very tight, needless to say. If you don't use your legs for about 11 months, everything gets really tight. So I'm starting to get more and more flexible, and it's essential to do that. So I'm fortunate that Dr. Derrington had a full kind of a regimen for me. All the the pre-post situation with I had a brace, and then everything was sort of spelled out. And so then once I got out of the protocol that Dr. Derrington had set up for me, I went with Dr. Dave, a physical therapy doctor, and it's been very good. I've been just seeing progress. At first it was slow, and then it sort of got to the point where I'm barely noticing. I almost have to search for pain. I'm down to painless days, and occasionally there'll be a little twinge. I just had a booster today, and I'm hoping that I get to the point where it's almost like just an afterthought. So I'm just fortunate to have met you guys.
Great. Thanks, Mike.